I am Lynn Treese, RN, Director of Student Health Services for the Paragould School District. I'd like to take this opportunity to talk with you about the health and safety plans our district has created through our Arkansas Ready for Learning Committee. We have worked on specific considerations related to health and safety and established district-wide health guidance based on most up-to-date CDC and Arkansas Department of Health guidelines. The guidelines provide measures that are available to help us stop the spread of the virus. The first one is wearing a mask. Wearing a mask allows us to try to stop the spread of the virus to someone else through speech droplets. A mask also provides some measure of protection to help prevent the inhaling of droplets from others. Paragould School District will follow the Arkansas Department of Health guidance on face masks required for students, faculty, and staff. Clean your hands before putting on your mask. Any mask should fit snugly over the nose, around the face, and under the chin. Once your mask is in place, you should avoid touching the mask to prevent the spread of germs. Sometimes you notice that people are touching their mask a lot, and it seems that it is falling down on them. So you may want to assess your mask and see, is it too heavy? Does it fit your face properly? And if not, then you may want to try another type of mask to see if that would work better for you. It may be beneficial for children and adults to do trial times of wearing a mask. You would start out for a short period of time and increase the exposure time of wearing the mask. There may be times when a student can remove their mask, and this would apply when they're at school and there is still a 6-foot physical distancing that is possible. So a student, if they have to leave their area though for any reason, they would need to reapply their mask. Another measure to help prevent the spread of COVID-19 is good hand hygiene. It's important to teach children how and when to wash their hands. It is especially important to teach them to wash their hands after using the bathroom, before eating, after sneezing, coughing, or blowing their nose. Washing hands with soap and water is the best way to get rid of germs. If soap and water is not available, though, an alcohol-based hand sanitizer will work. Students will be provided adequate time to wash their hands, and hand sanitizer will be available throughout the school. Social distancing of 6 feet will be maintained when possible in the school setting. Most people do not know if they have the virus until they have signs or symptoms, and some people don't have signs and symptoms. Therefore, we all need to do our best to maintain social distancing of 6 feet. Paragould School District also established an ongoing reporting system for school staff to evaluate physical health status and screening of on-site essential visitors. This is another method of protection against COVID-19 that Paragould School District has implemented. Each day before Paragould School District employees enter a school facility or a school bus, they will screen themselves, checking their temperature, answering a series of questions, and complete a daily report of their information to the district database. Health screening protocol for essential visitors will also be conducted by a trained school employee each time they enter a Paragould School District building. This is where we need your help. To ensure everyone's health and safety, we are also asking parents to complete a health screen on their children each and every day before they come to school. Your screening process will be: check your child's temperature. If your child has a fever, do not send them to school. Answer the following questions. Does your child have an unexplained cough, difficulty breathing, sore throat, recent loss of taste or smell? Have they been in close contact with a person who tested positive for COVID-19 within the last 14 days? Have they had a fever of 100.4 degrees Fahrenheit or greater within the last 48 hours? If the answer to any of these questions is yes, do not send your child to school. Contact your primary care physician for direction. There is a new guidance for schools from the Arkansas Department of Health. A child must be fever-free for 48 hours before they can return to school. Fever-reducing medications such as Tylenol or ibuprofen must not be administered during the 48-hour period. This will help prevent the spread of communicable diseases. Our district has identified and purchased all required personal protective equipment, PPE, that has been recommended by the Arkansas Department of Health. These include masks, face shields, goggles, N95 respirators for school nurses, gloves, and gowns. Infection control procedures will be maintained based on the Arkansas Department of Health guidance for nurses or designees when in contact with potentially infected students or staff. The students will have access to their school nurse should they need medical attention. If a student becomes short of breath, is coughing, or appears to have a fever while in the classroom, the teacher will call for the nurse, and the nurse will escort the student to the nurse's station from the teacher's room. This will help prevent unnecessary contamination between the classroom and the nurse's station. The parent will be contacted by the school nurse, and appropriate recommendations will be made. A designated district personnel will work with local public health agencies and community partners to ensure health and safety guidelines are current and followed. A school hotline COVID has been created by the Arkansas Department of Health, providing priority access between schools and the Arkansas Department of Health. There are Arkansas Department of Health employees and nurses that will be assisting us when school begins. We have been and will continue coordinating with our local health officials, the Arkansas Department of Health, and the Arkansas Department of Education in making decisions that foster the overall health of students, staff, and the community. Thank you for sharing your children with us. We look forward to school starting and want to assure you that we will continue to provide your child with the safest and healthiest educational opportunity we possibly can. Thank you and take care.